Hey, how you doing? We're going to do a case study on Mr. Ken Shear and kind of go over a recent low back situation that he had, what we were doing, how we were thinking, what was going on, and things along those lines, and kind of maybe show how these low back things are more biochemical and the result of chronic inflammatory situations and things than that, other than just, a biomechanical thing where you went and did something and now you hurt your back. That the biochemistry and the inflammatory process set the groundwork for disaster. And it's the thing that keeps this from healing. So, all right, we'll get going here. Got some notes. And what we'll do, so Ken presented to this office on April 13th, 2024, and he had the chief complaint of low back pain, which he believed was due to a flare-up of a disc injury. His complaints had lasted, or they began about a week earlier, and they were described as a stiffness, and he had to use pillows underneath his knees to sleep. Does that sound about?
Yeah, I also was running into the issue of not just the pain in there, but in my glute muscle.
Right.
It almost felt like when I was walking, my entire right leg wanted to just give out.
Right.
And it just felt like something was slipping. Something was not right.
Yeah.
Because the pain that I've had in the past was low back pain and numbness and tingling and burning down my right leg. I didn't have the burning or the tingling. This was very different.
Okay. Yeah, and that description could be an indication of a disc herniation in a specific type of one, and we can describe that a little bit later. But yeah, so there we go. So the examination that we did at that time was remarkable for tenderness in the right lumbosacral area, and there was muscle tension in the muscles of the thoracolumbar and the lumbar area. And in through that right hip and glute area. There's a particular maneuver that we do where a person bends the knee, lifts the leg, and there was weakness on that. But that was believed to be more due to pain and dysfunction than a sort of a neurological problem. As a matter of fact, there were no neurological findings. There was nothing running down the leg. There was no weakness. The muscles were strong. Things along those lines, bowels and bladder were fine, and so, yeah, that was really pretty much about it. So what we decided to do, since Ken had responded so well in the past to chiropractic manipulative therapy, we adjusted the low back, we did manual therapy on the hip, worked it through, and the low back muscles. Ken was instructed to take short walks, avoid low sitting, kind of like what I'm doing right now. The chairs are like they're too big. At any rate, to do some light to avoid doing exercising and stretching, and he was supposed to ice for about 20 minutes every hour or so. And so in addition to this, he was also shown a maneuver called Mackenzie maneuver or exercise. And what a person does is lays on their belly and they put themselves into a modified Sphinx looking position. And what it does is compresses the disc herniation, pushes it back midline, takes it off the nerve, and a few days of that, life's pretty good. So what was going on at that particular time when you were doing those exercises and all the rest?
I wanted to do those exercises because, as you know, I come from a kinesiology background, so they made sense. It's what I learned in school.
Right.
However, they didn't work.
Right.
What I ran into was, as I was doing them, and this is what was kind of baffling to me, was about an hour after I do them, I felt my glute area again, like wanting to give out. Like I would walk a few steps and I just literally felt like, I don't know if it was dry, I don't even know how to explain it. I could walk and I feel like I could fall over on my right hand side. And then I remember talking to you about it, and you looked at me and said, then I know exactly what's going on.
Right. Yeah, and that's what we did. So what I was thinking at that particular time is, we can't do Zooms. I have these things. But at any rate, what ends up happening is, let me see if I can do this anyhow. So what a disc looks like is it looks like a bullseye candy. Those caramel things with the white center, right? So when you have a little bit of a disc herniation, what ends up happening is we get this sort of degraded thing, and this kind of goes and it creates more of a bulge here. The nerve passes through this area. And so what I was thinking was happening was that we had a degradation of this white part of the bullseye candy. It was compressing and making this bulge hitting the nerve. And the nerve would have been this, the superior gluteal nerve. That gives you the sensation into the glute and the trouble with the feeling like the leg's gonna give out. What we were trying to do with that Mackenzie maneuver, where he would lay on the belly, was we were trying to push this material back into its space. Now, the thing to keep in mind with this is where this comes from is this does not come from a biomechanical problem. This comes from a biochemical problem. So what that means is that there's a chronic inflammatory situation and things, and there's a particular enzyme that gets here into this white part, which is called the nucleus pulposus, right? And it degrades it and it breaks it down. Once it does that, that same enzyme starts to bore radial fissures into the caramel part of this disc. And so we get a nice little leaning forward and off to the left. We push this down, squish, the material goes like that, and it goes onto the disc, or from the disc, and it goes onto the nerve and causes the problem. So this is when you have that kind of pain and it feels like it's going to give out and things along those lines. That's not necessarily neurological, it's inflammatory. It's the inflammation that causes the pain. It's the inflammation that actually causes this tissue to break down. So that's kind of what was happening and what I was thinking at that particular time. So, chronic inflammation, everybody kind of wonders about that, and it can come from a lot of different sources, from dietary type things, poor sleep, having the gut bugs being the wrong gut bugs, obesity, excessive physical activity without rest and recovery, stress, and the immune system just kind of wigs out and it degrades that disc. And that's kind of what I was thinking was going on at that particular time. So, any thoughts or any comments on what you were thinking?
All of that's pretty much on point at this point.
Yeah. So what happened from there, about 2 weeks later, Ken returned to the office and he reported that he was about 90 to 95% better, which I would have expected he would have been. He was icing, he was short walking, he was avoiding the low sitting. He was still kind of doing the Mackenzie maneuvers, and I will explain why the Mackenzie maneuvers probably weren't such a good idea in a little bit. But the problem was, just as Ken had said, despite feeling significantly better, he reported that it still felt like his low back could just go out with a wrong move.
That's correct.
Yeah, that's what he was saying. So, the fact that he was feeling these sorts of symptoms and having these complaints really wasn't that unusual, and what it was essentially an indication that he had not fully healed and recovered. Because the thing is, when that disc is inflamed, when the ligaments are inflamed and things along those lines, it's a destructive process. And with that inflammation, the thing you have to keep in mind is that the core will not fire, preload, and lock the spine in place. And that's the real problem. So we really have no stability in this situation. So you get that jolt and the leg feels like it's going to go out, and that gets to be a problem. So like I said, it was obvious that even though he was feeling better, he wasn't healing and recovering the way that he should have been. So at that time, I think you were doing a lot of traveling for work and things along those lines. Yeah, does that sound kind of like what was?
Yeah, I mean, everything that you were doing when I was here was working great, which is particularly obviously the adjustments and then the CryoFloss machine, which was fantastic. So those things always made me feel better.
Right.
But like you said, you've hit it a couple of times now. I just felt like something else, it wasn't there yet.
Yeah.
Like there was something else going on.
Yeah, what you have to keep in mind is that pretty much everything we do, even sitting here, we are breaking down and deteriorating and degrading the tissues of our body. So you need the immune system to come in and repair that tissue. And what you're looking for is you want a situation where, let's say this is healing and recovering, and this is degradation, this is breaking down and stuff like that. We want a situation where the breaking down is at this pace, but the recovery is greater than the breakdown. In your particular case, what was happening was that the breakdown was greater and the recovery was not catching up with this. And that is essentially what the problem is. So in early part of June 13th, you had sent me an email saying that your low back was still giving you fits. And I gotta be honest with you, yeah, I was kind of surprised to hear that. That was about 6 weeks later, and I'd figure you were done and off and running around and living la vida loco and all the rest of the stuff. You had also mentioned at that time that the McKenzie exercises definitely weren't helping, and that anytime you did any sort of extension, which is leaning back, you felt like your back would go out, or it would go out a couple hours later. At that time, you scheduled an appointment, you saw your medical doctor, ordered x-rays, scheduled an MRI for early July, and the medical doctor recommended PT, medications, and perhaps an epidural injection if that didn't make things happy. So you had contacted me and you wanted to know what my thoughts were and what my opinions would be, and so we brought you in and did another examination. So you want to tell us about what the medical doctor was thinking or saying at that time? Or?
Well, they did a variety of tests. They obviously knew my history of having a herniated disc. I told them the same as I told you. This one was very different than normal. So they had ordered an x-ray. The x-ray showed degeneration, which we're not surprised with. And then I had an MRI as well, which it was a pretty lengthy report. It was all lumbar, lower lumbar areas. But you thought it was a ligament, you thought it was more lateral, so you changed the type of McKenzie exercises that I was doing, which I'll let you explain.
Right.
But again, the adjustments helped. You also made a few other suggestions, which I'm assuming you might discuss right now. But I could tell we were improving, but something wasn't quite there yet. And then I think that's when I came in, we went through all of this again, and the light bulb went on for you, and then we were really on the path to healing at that point.
Right. So at that particular time, we did another examination, and sure enough, there was remarkable pain in this right lower back area, the fourth and fifth lumbar and first sacral segment, and there was a lot of tenderness along through these muscles and in through the hip. Again, there were no neurological findings, and it looked like for some reason, as we had indicated, that you just simply were not healing and recovering. Or perhaps there was a new injury that was much worse than the one that you had back originally in April. Either way, there was just a low-grade, unresolved chronic inflammation that was going on, and it was damaging the discs and the tissues of the lower back. I don't know if you're going to be able to see this, but the disc itself, like we said, we described that it looks like a bullseye candy, those caramel things with the white center. But what it's really made up is that caramel stuff is made up of ligaments and cartilage, right? So what that means is it's comprised of collagen. And so collagen is the building block of these tissues. Collagen is also the building block of bone, of tendons, and especially of ligaments. So whatever we had going on was basically attacking and breaking down this collagen, okay? And that was what was going on. That white part is a compound that they're called proteoglycans, but what they do is they absorb a lot of water and fluid, so that what the disc looks like, and of course my prop went away, what the disc looks like, it will say this is that white part. It's supposed to be able to take all of these compressive forces, and then that caramel part holds that in place, and we create this spongy, nice little something or other. When this starts to break down and degrade, and it starts to bore these fissures, we lose this ability. So automatically what that does is it alters and changes the mechanics of the lumbar spine. All right, there's the significance of what we have going on here with that. So before we got the MRI, what we decided to do is that we figured, okay, so we've got inflamed ligaments, inflamed cartilage, perhaps the bone, a lot of different things are going on. So first thing we decided to do is use a lumbar brace. And the purpose of the lumbar brace is to help support the back, because like we said, when you have that pain and inflammation, the core will not fire, it will not lock that spine in place, okay? Secondly, ligaments go from bone to bone, and they're supposed to hold bones in place, which gives us a stability thing. And if they're injured, they're not going to do that. So the brace made a lot of sense. That holds that. The next thing we decided to do was use a physiotherapy machine, which is called high volt galvanic current, which is an electrical muscle stim with ultrasound. What that does is it contracts the muscle tissue, and then the ultrasound cleans it increases circulation to clean the sludge and garbage out of the area. When we were done with that, we used another machine called the CryoPhos, which is a liquid carbon dioxide that is it's a cryotherapy.
It's literally the coolest thing ever.
Yeah, literally, yeah. So we shoot that onto that particular area, and what it does is it creates a thermal shock. So within a few seconds, that area we're spraying with the liquid carbon dioxide drops down to about 39 to 34 degrees Fahrenheit, creates this shock. So it shuts off the circulation to the skin, it activates these tracts in the spinal canal that regulate pain, and it shuts the pain off, and then the deeper circulation goes and it cleans the inflammatory sludge out of the area. So that's what we were basically doing.
Can you just talk about, I think what all that stuff is great, but there's something different about the brace you had me wear. I've never seen a back brace with those little things that you pull on.
Yeah.
So
what the back brace is, you just sort of wrap it around, and there's these two little rip cords. And so you just pull the rip cords, and then they stick to the Velcro. So you can snug this thing up as tight as you want. And so you'll know immediately. We put the back brace on, we put this over, and all of a sudden it's like the pain's gone, you feel great, it feels strong. And so what we're basically doing now is the brace is doing what the core and the ligament should be doing, but aren't able to do. And you can just tighten that.
And I remember looking at you and Dr. Diane, as soon as we put that on and tightened it up, I immediately felt better.
Yeah, and that was the thing. So good, bad, or otherwise, you were either doing stuff that was keeping this aggravated, or we just could not get ahead of, like we said, that healing process apart from that inflammation for whatever reason was going on. So yeah, that's essentially what we did. Good. So what I think I'm going to go ahead and do right now is that you responded real well to that care, and when you came back in a few days later, you had a few twinges in your back, but it did not go out, did not feel like it was going out. Everything looked pretty good. We continued with doing the CryoPhos, the combination, the short walks, and we did a little bit of spinal manipulation at that particular time. So that worked out fairly well. On the 1st of July, you had your MRI, and you came in on the 3rd of July with that. And the thing that's interesting about this is that as we go through this, we find that, and when you hear the letter L, it stands for lumbar, and there's 5 lumbar vertebrae, right? So what we find is at L1, L2, there was a minor bulge. At L2, L3, there was a minor bulge, or a mild bulge. At L5, S1, there was a mild bulge. And L4, L5, there was a mild bulge. And L5, S1, there was a mild bulge with a small central protrusion, which means the disc. So on this drawing that I made, we most definitely had this, but it didn't go off to the side. It went more back in toward the central area here and pushed in. But the significance of this, which is real interesting, it's like, all right, so he has a bunch of disc herniations. Yeah, however, this is the one that was the most telling. So what we do is at L4, L5, there was a mild bulge, but there was moderate to severe right facet hypertrophy. So what that means, and you probably won't be able to see, but there's joints in the lumbar spine, well, in all the spinal segments, and much like a diamond has a facet, so does the lumbar spine. And so hypertrophy means that it grew thick, right? So it was swollen, it was degenerated, and so on and so forth. Now, this would not have happened in a few days. That degenerative change is very old. And so where that comes from is, like we were talking about, as that disc is no longer able to handle and transfer compressive loads, it alters the mechanics of the back, and we start to see degenerative changes start in other parts of the lumbar spine. And so that's why that McKenzie maneuver didn't work, because you would have been leaning right into that inflamed facet joint. So with that, there was also, which I thought was interesting, they also explained that there was mild edema in the dorsal paraspinous soft tissues. So in those muscles of the back, there was fluid, there was swelling with that. And around the facet, which is the joint at the 4th and 5th lumbar vertebrae. And they said that that was likely degenerative reactive. And so what that meant is that we had moderate to severe right facet hypertrophy at L4, L5 with associated marrow edema. So the bone looks like honeycomb. So we actually had inflammatory fluid inside the bone. Sounds painful. And the surrounding soft tissues had fluid. And so the person that read this said that there was a good chance that that was the pain generator. So the point I want to make about that is that all of this stuff was super old, right? The hypertrophy, the disc bulges, and everything else, that didn't just happen. But what did happen was the altered mechanics and probably the inflammation that they find here, and that is why this would not heal and recover. Now, the thing that's interesting, by the time you came in and we saw you with this report on the 3rd, you were remarkably better. As a matter of fact, I think you had stopped wearing your brace and all the rest of the stuff. So the thing that's interesting is that 2 days later, with these sorts of findings, you were better. And I guarantee you this stuff didn't go away. The only thing that would have happened is that healing process finally caught up with the degeneration and you started to heal and recover. Mm-hmm. So does that make some sense?
Yeah, I mean, I think it was all great. I think that the one thing also, you took all of your findings and everything that you suggested with the brace and with the adjustments and the use of some of the modalities that you used were great, but also you had me look deeper into my diet as well. Right. And because I deal with an unfortunate, insane amount of food allergies, during this time I was traveling summer travels with family, so of course you start eating differently, and I also think that what played into the level of some of the challenge that I have was an increase in inflammatory foods.
Yeah.
So the two-prong approach that you use here and what you suggested with the modalities and the brace was great, but also looking into my diet and me working on getting rid of some of those inflammatory foods, I think also played a huge role into the full healing process. And now today is August 27th, so a good 3 or 4 months in, and now my back doesn't feel like it's giving out. I don't need the pillows anymore. I know that I deal with a chronic low back issue. It's not like I'm choosing to have surgery to cut no, that's not gonna happen. But there is a lot of things that you look into here that a lot of other people don't. And I think that that's 1000% why I feel the way that I do today.
Right. I think when we look at it, I don't think you had more than 4 adjustments total. I know, and the problem is when that inflammation is so great, the adjustment's probably not going to be enough to overcome that particular pain. And the truth of the matter is that the vast majority of low back pains will resolve themselves on their own. And so what they become is a managerial problem. And so it was really looking and not just saying, well, we got to crunch, 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 and we'll keep our fingers crossed. But at the bottom line, it's like, wait a second, it's been this long. This guy should be better. He should not have pain. He should not 2 months later be walking along and feeling like his back is going to give out. And without any other findings or anything else, the only thing that really comes to mind is inflammation.
Yeah.
There had to have been some sort of a chronic thing going on, and it was not healing and recovering, especially when it's designed to do that on its own. And it wasn't. You think of that, like you say, well, what's the big deal about the food and everything? Well, if you're eating inflammatory food, your immune system is handling all the things that the inflammatory food is causing, while also trying to resolve a low back where we have inflammation in the bone, we have a thickened degenerative joint here, and we have disc herniations or bulges at every level in the lumbar spine. How's it supposed to do that when you're going to eat and live an inflammatory lifestyle? It just can't. It just cannot get over the hump and fix it. So it really becomes a managerial type thing. So it was real interesting to me because I knew we had the disc herniations. And I thought it was pretty interesting when we found that we had this hypertrophy in this joint. And it's like, yeah, that would have come from altered mechanics over a long period of time, but not within a couple days or a couple months. And so that shows that these disc herniations are definitely, and the only way we get the disc herniations is with chronic unresolved inflammation.
So I'm healed.
You're healed, you're on your way. Yeah, that's beautiful. All right, so anything else you'd like to
No, I
say?
think my biggest thing would just be, it's like, when you come here, not just to see you, but everybody else, you look at the whole body.
Yeah.
And I think that that's one of the biggest things, because I'll be honest, when I did see my doctor, I said that I didn't want to see a physical therapist. I said, I want to go to my chiropractor. They look at things differently. I could almost see her face. Like, I'm not sure that, I'm like, no, they're going to get me there. They understand the exercises I need to do. They have modalities. They don't just, I'm not just going in to get adjusted and they say, see you later. They will look at the big picture. And once again, this is not the first thing that you've helped me with. So, I really hope that this video can be shared with other people that have, and listen, low back issues, a lot of people do. And there's a variety of different low back issues that are out there. But I believe in your approach of looking at the whole entire body, the physical, the mental, the eating, the pain relief, it all came into play of why I feel as good as I do 4 months later with a pretty lengthy amount of issues in my lower
Oh,
back.
yeah. And you know, if we were to fire off an MRI right now, I think we would probably find less inflammation, but I don't think it would look any different. And that's something to keep in mind. That's why we don't really rush to MRIs and x-rays and things along those lines, because the truth of the matter is, yeah, we might be able to say, well, that's the pain generator, but we had the general concept, and whether we had the right structure or not, the mechanics were true. We had a biochemical situation, disc herniation, inflammation, altered lumbar mechanics to the point where the ligaments and the tissues were not functioning correctly. We handled the inflammation. We got that stuff to finally start to heal, and now you're on your own. And the funny part about it all is that your body is actually designed to do that if you give it a chance. And that's where the diet and a lot of the other things. I think also key to this was it's not so much what you do as what you didn't do. We stopped the gym. Most people want to figure they're going to go to the gym and they're going to strengthen this out. They're going to work it out or stretch it out or heat it out or something like that. And that's all very, very destructive on something that's already chronically inflamed. And your first clue is, hey, I'm not getting better. Then you're not healing and recovering.
I agree.
Good.
All right. Thank you.
Well, hey, thank you, man. I'm glad you're doing better. And I guess that'll do it for this case study. Please let us know what you think. And yeah, hopefully we can help you.